Vitamin Water Zero Sugar has great taste, zero BS, and obviously, zero sugar. For those with zero room in their calendar. Zero patience for slow walkers. Those who get 0 hours of sleep on a Saturday night. Have zero filter, zero given, and zero interest in grabbing a plain, boring water. Grab a delicious Vitamin Water Zero Sugar today.
Cold plunges, breathing deep, gadgets you can buy online. Can they really stimulate your vagus nerve? Let's find out. Hi, everyone. I'm Barbara, and this is Age Better. In a few minutes, you'll hear part 2 of my conversation with Dr. Kevin Tracey about the vagus nerve, my latest obsession. After you've listened to both part 1 and part 2, you will sit back and say, wow, now that was a true masterclass. Now, if you missed part 1, don't worry. The link is right in the show notes, and I encourage you to go back and listen because it lays the foundation for everything we're talking about today. You'll also find a few other resources linked there that will help you understand just how powerful the vagus nerve really is. And here's a quick reminder of who Dr. Tracey is in case you're just joining us. He's a neurosurgeon, the CEO and president of the Feinstein Institutes for Medical Research, and one of the most frequently cited medical experts in the entire world. The whole world. He is the founder of the field of bioelectronic medicine, which is sort of new, and the scientist whose decades of work led to the very first FDA-approved device that uses vagus nerve stimulation to treat rheumatoid arthritis. And this made headline news around the world. His hope is that one day, therapies like this might even replace the need for many of the drugs that we all rely on today. So that's pretty exciting. In this second part of our conversation, we're getting a little more practical, like what life with this implant really looks like, why it works with just like 1 minute of stimulation a day, and who can benefit the most. We also dig into the everyday questions that you and I both have, like things we've heard online, like whether cold plunges and breathing practices or those vagus nerve gadgets online actually work, or if they're just hype. He will tell us. And here's something special. Dr. Tracey has agreed to answer your follow-up questions. So if something comes up while you're listening and pops into your head, just email me at agebetterpodcast@gmail.com, and I will make sure he sees them. And I love this part of the conversation because it's all about what matters to you, what's worth trying, what's not, and how this science could actually change your life. And don't forget, we're giving away copies of The Great Nerve, Dr. Tracey's seminal work on the vagus nerve, a book that just came out a few months ago. To enter, all you have to do is share the link, hopefully after you listen to it, to this episode on Instagram, tag me, Barbara Hannah Grufferman, and you'll be entered to win a copy. All right, everyone, get ready to age better.
You know, we talk about Kelly as such a success story, and she is, and I've met several other patients with similar stories now, so she's not a one-off, but we still don't know, Barbara, and this is really important. No one's advertising this as a cure-all. No one is promising this is going to help everybody. There's still a lot that we have to do and a lot that we will learn, because I fully expect that based on the current data are that 80% of the patients 1 year after the vagus nerve implant, these are patients that were selected because they have rheumatoid arthritis, but are not getting better with biologics or JAK inhibitors, that in that cohort of patients, about 80% of them derive some significant benefit. That means 20% either derive no benefit that was noticeable, and some cohort of the 80% had a much more significant advantageous response than the rest. So how that all sorts out is something we have to be eyes wide open and very careful, but it's very, very clear that this can be done safely. It does not cause immunosuppression.
Mm-hmm.
It does not cost $100,000 a year for life,
Right.
recurring annually. and it can be safely done. So I think it's going to come down to early adopters and late adopters on the physician side. I think you will have some physicians very aggressive about recommending this for their patients, and some other physicians who will be cautious, conservative, and go much slower. And that's okay. That's okay.
Yeah.
But you're also going to have something happen in the patients, and you're going to have patients who are now better informed and smarter than any other time in the history of the human race because they have access to the data and they can make decisions. They can participate in some of the decision making. And I think you're going to have patients demanding this.
Absolutely. And just so my audience knows, right now is Northwell at your center the only place where you can get this treatment?
That's a question for Setpoint Medical.
At Setpoint, yeah.
Yep. Setpoint Medical has an outstanding website. I would encourage your patients to look there.
I'll put it into the show notes so they can take a look. Yep.
We did implant the first 2 patients under FDA approval about a week ago at Northwell, the first anywhere in the United States. And those patients are now out there about ready to, I would imagine, it was about a week or 2 ago. So they'll be in the process of having the device activated, and hopefully they'll have a clinical response. There are a lot of logistical issues to launching a brand new medical product. There are logistical issues with establishing what's called prior authorization mechanisms, dealing with the insurance mechanism. All those things are happening. There's an army of people working on that at Northwell and at Setpoint. My understanding is that Setpoint will have a sort of a slow launch in the coming weeks and months at several sites across the United States where there will be the necessary expertise and experience. You don't want to launch something completely new just out into the universe and see what happens. You want to, for the sake of everybody involved, you want to have the best people who are trained to do this, doing it on the right patients in a few select centers. And I believe that's the phase we're in now. However, in the coming months and years, I think you're going to see a lot more clinical trials. I think you're going to see studies in multiple sclerosis. I think you're going to see more studies in inflammatory bowel disease. And who knows, the list of potential autoimmune conditions that should be studied. We don't know until we have the randomized clinical trial data, but should be studied. It's a long list.
It's a very long list. And just curious too, do we know yet if the implanting the stimulator, if it needs to be repeated? Do we know that?
We know that it
will it wear out?
The label from the FDA on the device, the Setpoint device is called an immunoregulator, and we can talk about how that works. But the label for that device from the FDA gives it a 10-year lifespan. That doesn't mean it'll stop working after 10 years. It may, in some cases, it may in fact last for the lifetime of the patient. See, the battery is rechargeable. So the chip itself has a computer motherboard. It has an antenna that talks to the doctor's tablet or iPad. And it has a lead which touches the vagus nerve and a battery. And as I said before, it's about the size of a multivitamin, but it's wrapped in a pea pod that holds it in place on the vagus nerve. And once a week or so, the patient, and there's nice pictures of all this on the Setpoint website, but once a week or so, the patient puts on a charging collar and wears it for an hour or so, and that charges the battery. So no, it should never need replacing.
Yeah, just similar to a pacemaker.
Similar to a pacemaker, only in this case, of course, it's a lot smaller.
Yeah.
And the other big difference is that the immunoregulator activates the inflammatory reflex to stop inflammation for 1 minute a day. But by the nature of the mechanisms, the neuroscience and molecular mechanism that we worked out in my lab and in labs around the world and in Setpoint's labs, by the nature of understanding those mechanisms, we realized that there's an amplification of the 1 minute signal. And that amplification, which stops inflammation, persists for between 12 and 24 hours. So a 1 minute stimulation is all you need every day.
Incredible. Just such a small amount of time. I'm also curious about those people who, I think you said 20% of those who have participated didn't really have the positive outcome as you had hoped. Is there any indication in your mind prior to their having this performed that oh, these people may not have the same as good an outcome as others? Is there anything, or is it a complete surprise?
As of today, we can't look at a patient before they've gone into the trial or in for the therapy and say, you are or you're not going to respond.
Mm-hmm.
What we did see in the first clinical trial, which was presented at the American College of Rheumatology last year, and now almost all the data are available on the Setpoint Medical website. But what that data shows is that patients who were had tried 3 different biologics versus those that had tried only 2 versus those that had tried only 1, that the patients who'd been on 3 now, usually that means they've had serious disease for a much longer period of time.
Right.
And those patients tended to have less significant responses in some cases than those patients who had only been on 1 biologic. I mean, Barbara, the way to think about it is name a disease or condition, any disease or condition, where treating later is better than treating earlier.
Yeah. I can't think of one.
Right. And so I think what we're going to learn is going forward in time, if it works in a significant percentage of patients when you treat them early versus late, then how many people should be treated earlier and earlier? Right now, the FDA approval is for treating patients who have, as I said before, are either refractory, not responding to, or cannot tolerate the biologics and the JAKs. But maybe someday, could I imagine a time when the device is used instead of those drugs?
Yeah,
Yes, I
yes.
can. I can
Yes,
imagine
yes,
that
you
time.
can. I know somewhere, I think when you and I were on the phone, I read in the inside, not on the cover, but the inside of the book jacket, and that really struck me. And I quote, how the vagus nerve can regulate your body's vital systems and heal a wide variety of medical conditions without drugs. And so basically, I think your goal, I'm going to simplify it, tell me if I'm wrong, is to really have this in all its different ways and uses eventually replace a lot of the drugs that people are on for these chronic conditions, right?
To the extent that inflammation is the target, in other words, to the extent that people are using expensive medication with serious side effects, absolutely.
With side effects in many cases, maybe don't make them feel ill or not as well as they could be. Absolutely.
I mean,
There are so many reasons why you would want to consider this.
And I think for where we are today is the first FDA approval for rheumatoid arthritis. Where we need to go is we need to continue to do randomized clinical trials.
Right. Lupus, I wrote down a few that are kind of in that category of autoimmune, lupus, Crohn's. You mentioned that multiple sclerosis, of course, Alzheimer's we mentioned. I guess the common thread across all of these is inflammation, right?
That's the key to this. And so to wave your hands and say inflammation is the root cause of everything, that's an exaggeration. However, when you look critically at what's killing people on the planet Earth today, well, 60 million people die, according to the WHO. 60 million people die on planet Earth every year. 40 million of them, 2/3, die of cancer, heart disease and stroke, neurodegeneration like Alzheimer's and Parkinson's and other conditions like that, metabolic syndrome, diabetes, obesity. Now, what do all those things have in common? Inflammation. Inflammation either makes them worse or starts them up or contributes to the bad outcomes associated with that. So now I like, as a scientist, as an inventor, I like to ask a question. If we could stop inflammation, would you lower the severity of ovarian cancer or endometrial cancer or uterine cancer? These things are linked
Yes, they are.
to insulin resistance and to inflammation. If you lowered the inflammatory burden, would you lower the death rate from some cancers, inflammatory breast cancer? Maybe.
That's the
It's a
big question that you must all be asking in your lab.
Well, look, my lab's not big enough to answer all these questions, and that's why I wrote the book. As you read it, there's a plea in the book to not talk about this as snake oil, okay? The vagus nerve control of inflammation is not snake oil, and it's not going to help 100% of people. It's just that's not how biology works. However, it's a really important series of questions that we can now ask. A great example is depression anxiety, where the FDA approved vagus nerve stimulation for the treatment of depression in the 1990s. Why does everybody not know that? Well, because it only works in about half the patients. Why does it only work in half the patients? Well, we're not really sure what the mechanism is. And so there's a scientific question there. Can we connect the dots between reducing inflammation using vagus nerve stimulation and depression? And the answer is, well, sure you can, because when you have inflammatory mediators surging through your bloodstream, you become depressed. You become fatigued, you become anorectic, you lose interest in food and in sex and in your hobbies.
In life.
And in life.
Yeah.
And so now the question is, did the 50% of people with serious depression who did get better with a vagus nerve stimulator, was that because they had an inflammatory condition that got better with the vagus? The answer is maybe, but nobody knows.
Yeah.
So we've got to stop and take a breath, all of us, and the patients and the clinicians and the researchers, and say, what are the important questions we can ask now with new technology? And rather than dig our heels in the ground and say, well, it's always been done this way or that way, we have new technology and new questions. What are the clinical trials we have to do? It's really an exciting kind of idea.
Oh, it's an exciting time. And we will right now get to some other new technology, some new treatments that are out there that are maybe not as invasive, not that that's incredibly invasive at all. And we'll get to those in a second. But I'm just wondering, I mean, it kind of begs the question, like you mentioned knee arthritis, you mentioned arthritis that you might have a little pain in your knee. I have that. It's probably age appropriate, which kind of sidelined me a little bit from running marathons at the moment. But I mean, it begs the question, if I came in and said, please implant that into my neck, isn't it possible that my arthritis could be alleviated?
So the arthritis in your knee from presumably recurring stress or running injuries is not rheumatoid arthritis. And so
it's not.
So the scientific answer is we don't know.
We don't know.
We don't know if a vagus nerve stimulation in humans with osteoarthritis would benefit them. But you could do the clinical trial someday, right? With the right
Yeah,
resources.
count me in. Count me in. I'm putting my name in. I'll be one of like the 100,000 people who put their names in.
If you go on clinicaltrials.gov, you will find osteoarthritis trials with various devices that people call vagus nerve stimulators. But before we dive into that, in reality, there's only two ways to stimulate your vagus nerve specifically and or selectively. One is to have a surgery and put a device on it. And this surgery has been done in more than 250,000 people who've been followed over decades. So we know how to do it. We know it can be safely done. We know it doesn't cause immunosuppression. It doesn't have a black box warning. So that's one way. The second way to do it is to use focused ultrasound, which is still an experimental modality. It's not available for widespread use. Those are the only two vagus nerve stimulators. Now, if you Google it, you'll find dozens and dozens of things being marketed and sold as vagus nerve stimulators that don't require surgery. And there we have to be really careful before we part with our money. We have to really look hard. Is the device FDA approved? What did the FDA approve its use for? And has it been subjected to well-controlled, large randomized clinical trials, and have those been replicated?
Yeah,
so
no,
those
this
are the
is
kind of questions.
so important. And then, so jumping on that, so you envision less invasive approaches in the future, like external wearables, perhaps, and we also things like focused ultrasound. And you were a part of creating the Focus Ultrasound Foundation, too, which I'm going to put a link. Yeah, a lot of links are going to be in the show notes, everyone. So lots of reading for you. And also TENS, TENS, and VNS. You talk about all of these in your book, The Great Nerve. But just talk to us a little bit about them. I mean, those are available at the moment.
I think it's really important to point out that for your listeners with severe rheumatoid arthritis, if it was as easy as buying a TENS unit or something over the counter or doing a few extra push-ups or sit-ups and their rheumatoid arthritis would be better, they'd obviously all be doing it.
Right.
So I think there's going to always be a need for implanted devices like the set point immunoregulator, which through a one-and-done incision to have the kind of clinical effects that are possible in some patients, that's not going to go away. Now you have people like you, perhaps, not like me, perhaps, we're pretty healthy, we're fortunate, but we want to see if there's ways to reduce some aches and pains or reduce our potential risk of inflammation. What is the data on that? Well, the data is really interesting. So there's a large amount of clinical trial data. Most of it is small trials. Most of it's not randomized or well controlled. But there's a lot of suggestive anecdotes that using a TENS unit to treat the ear, particularly the left ear for some reason, that's where most of the studies have been done, can in some patients significantly reduce inflammation. Now, my colleagues and I at the Feinstein Institute here in New York, we saw this in lupus arthritis patients whose arthritis was significantly, their pain anyways, and their arthritis scores were significantly reduced with this approach. So you have clinical results, and you have the use of a TENS unit in the ear, and you have a branch of the vagus nerve that goes to the cartilage of your ear. So is that vagus nerve stimulation? No, not really, because you have other nerves that go to your ear. So you don't really know when you put that TENS unit in your ear if you're stimulating the vagus nerve or a branch of the facial nerve or the trigeminal nerve or the superior occipital or some other nerve. So it's a semantic issue, again, to a point. And if it was just a semantic issue for scientists or physician scientists talking among themselves about how something works, that'd be fine. But people are spending a lot of money on this.
Yeah.
And now, I think caution is warranted. If people have money they want to spend and they like to self-experiment, I think I'm a fan of that. I think it's kind of fun, actually, to self-experiment with various healthy techniques as long as your physician says it's okay and it's safe. But some people don't like to self-experiment. Some people want to spend their money on things that'll help them feel better. And there, I think you have to be really careful. You have to look at what the FDA label is and what the clinical trial results are for the condition you're trying to treat, including your sore knee.
Right. I'll be careful when I'm looking around, when I'm Googling, or my new favorite thing, perplexity. Let's talk about social media because we have to. So there's been a lot of buzz, as you said earlier on, about the vagus nerve and stimulating the vagus nerve in all different ways, even selling some products, as you just pointed out recently. And we talked about this last week. I listened to the Huberman Lab, as did you, his episode about the vagus nerve. And he was talking about putting your finger in the ear or rubbing your ear and so on and so on. A lot of different things. There are a lot of talk about stimulating the vagus nerve. And every influencer out there seems to know how to do it better. So let's just talk about, let's cut to the chase, Dr. Tracey. What really does work? Sounds like nothing. And what should we just no, don't do it.
I think Andrew Huberman did a really good job in his podcast talking about the fact that the vagus nerve has lots of fibers and that one way that you can sort of measurably, quote unquote, stimulate your vagus nerve is through changing your breathing.
Mm-hmm.
So if you think about it for a minute and you want to breathe in on 3 and out on 7, that's 10 seconds. That's a cycle of 6 breaths a minute. Okay, so far so good. Now, you think about changing your breathing. So therefore, you get your stopwatch or you start counting to 3 in your head and you inhale 2 big inhales through your nose, like sniffing. And that fills your lungs. What happens in that 3 seconds to your vagus nerve? Well, we sort of talked about Steve Lieberlis in the beginning of the podcast. And there are fibers in your lungs that are traveling with your vagus nerve that are sensory, meaning they're carrying information from the lungs to the brain.
Mm-hmm.
And they're going to inform the brain how much pressure is in the lungs and how much carbon dioxide perhaps is in the lungs. And so there you go. You've stimulated your vagus nerve, right? Technically.
Okay.
But what does that mean? Well,
right.
Not really sure. Now, those signals go into your brain and they activate reflex circuits that can go to places like the locus ceruleus that actually controls your sympathetic outflow, your fight or flight response. It also sends projections up into your brain that affect your emotional state and even potentially your ability to learn and make new memories. It gets really complicated really fast.
Mm-hmm.
That those few fibers from your lungs send a signal up into your brain. But put that aside for a second. One of the relays of those incoming signals is outgoing signals from the vagus nerve nuclei called the dorsal motor nucleus of the vagus and or the nucleus ambiguus. Some of those fibers now go from the brain back to your heart. And now what's going on with those? Well, as you exhale now for 7 through pursed lips on a slow count of 7, so you get back to the 10-second cycle,
Yeah.
you'll feel, if you check your pulse, you'll feel it slow down.
Yes.
That means that you have stimulated the fibers from your brainstem to your heart that slow your heart rate. So that's only a little subset of all the vagus nerve fibers that you actually did stimulate, because there are vagus nerve fibers that are transmitting information about lots of other organs in your chest and your larynx and your airways back and forth from your brain when you take that in on 3, out on 7. So the simple answer is, if your heart rate slows, you have sort of an actionable or objective measure that you've stimulated the vagus nerve fibers to your heart. Does that mean that in on 3, out on 7 also stimulates the fibers traveling from your brainstem, dorsal motor nucleus, down to your spleen to stop inflammation? Nobody knows.
Nobody knows.
Nobody knows. Now,
Interesting.
if you're incapable of walking and chewing gum, and that every time you chew gum, you start to walk because all of your nerve fibers are firing at the same time, then you might say, okay, the heart rate slowed, I must have less inflammation now. But I don't believe that the nervous system developed that way, evolved that way, or functioned that way, because I don't know anybody who can't walk and chew gum at the same time. And I think you can separate the signals to the heart from the signals to the spleen and the signals to the lung. And the challenge now in the modern era is to answer this question. What methods can we put in place? What kind of tools can we invent to record the activity of all 200,000 vagus nerve fibers in humans in real time? We can't do it today, but someday I bet we can.
No, that's really incredible. So really, in summary, then, you're helping to slow down your heart rate if you do that breathing. And I think I told you on the phone last week, too, one of the reasons I became so obsessed with the vagus nerve is about over 2 years ago, I had on the show Patrick McEwen, who's written some books about breath work and breathing properly. And he convinced me that it all goes back down to the vagus nerve, and you can, in fact, control your vagus nerve. I mean, he was very sure about that you can control your vagus nerve with proper breathing. Whether that's true or not, I have found that proper breathing, according to Patrick McEwen, does help to lower my heart rate. I mean, sometimes for fun, I'll just like look at my Apple Watch and kind of put the pulse thing on and just watch it come down by doing that breathing. Now, again, am I also impacting my spleen? I think we don't know, right? Is the point. We don't know that.
You could quibble with semantics, but in science and medicine, semantics are sometimes as important as anything. And are you really controlling your vagus nerve, or are you controlling your breathing?
Right.
You're controlling your breathing.
Right.
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 I mean, there's a guy named Wim Hof who's done a lot of work with cold exposure and combining a series of rapid, deep breaths followed by a prolonged breath holding, and then repeat the cycle 30, 40 breaths, big inhales, big exhales. And what he's doing is he's accumulating carbon dioxide in his bloodstream by a series of repeated hyperventilations. So he subjected himself to study in a study led by Peter Pickers, another colleague in Amsterdam.
Mm-hmm.
And what they found is that the breath work was a massive, and the breath work in this case being this rapid breathing followed by prolonged breath holding, that stimulated a massive fight or flight response. Now, it's the opposite, of course, of a vagus nerve response. Vagus nerve is often called rest and digest or parasympathetic, and the fight or flight is the sympathetic response. Well, this massive fight or flight response acutely turned out to have a very profound anti-inflammatory effect. And so here is another example where many people are quick to say sort of casually, well, if fight or flight is on, rest and digest must be off because they're opposite. They're not opposite. This is a great example where fight or flight has an anti-inflammatory action, as an acute, powerful event. Vagus nerve stimulation as an acute, powerful event also has an anti-inflammatory action.
Mm-hmm.
And in fact, during fight or flight, it doesn't mean the vagus nerve has been turned off. It's just, while it's working, you can't see it because its job is to slow your heart. And what you see during fight or flight is you see an increase in heart rate.
Right, right.
There's a lot to unpack there.
Oh my God, it's so complicated. But just give us the bottom line on that, Hop's research and what he did, the experiment. What was your takeaway of that? So will this cold plunge, it affected his breathing and his heart. In your opinion, did it stimulate the vagus nerve or no?
The acute exposure to cold.
Yeah.
If you put your shower on full cold or jump in an ice bath, the acute exposure to cold causes fight or flight. That's the acute response. You feel all the air go out of your body. It hurts. You think, why am I doing this? That's fight or flight. And that's been studied and documented very clearly that the acute severe cold exposure causes fight or flight. That's why you have to check with your doctor before you do it.
Before you do it, yeah.
And you should never combine the breathing exercises and the breath holding with anything in a swimming pool or an ice bath. And you should have colleagues there. You shouldn't do it alone.
Yeah. Yep.
Because that has led to some deaths, and the combining of the two has to be done under supervision if you do it. But I'd recommend you don't do it. Anyways, the acute cold event causes fight or flight, which I just said is anti-inflammatory. So check that box. That's good.
Yep.
If that's what your goal is. Now, if you stay in the cold and become cold adapted to the point that what I notice is that it almost feels like, some people call it relaxation. It is a type of relaxation, I guess, but I'm still aware that the cold hurts. But it's like it's happening to somebody else now.
I can't imagine that's relaxing.
I find that if I stay in the cold until I'm cold adapted, that it's almost like I'm watching it happen to somebody else. I'm aware of it and I'm aware that it's not comfortable, but somehow it doesn't bother me so much. Now, once you're in that state, I won't call it relaxing because that
just doesn't sound relaxing.
No, it gives a different connotation. But if you're in that state and you check your pulse and you find that your pulse has slowed, now you have, in fact, you could go back to the argument we had before. You can make a strong argument that that's a state of vagus nerve stimulation. But that usually takes a few minutes of being in the cold until that adaptive phase occurs.
Yeah. Yeah. And it sounds like you do it because you said when I do. Am I right about that? Did I catch that right?
Yep. I don't do it every day, but several times a week, I'll put the shower on full cold and I'm hedging my bets, right? It's Pascal's wager.
I agree with you completely. I saw a lot of studies about that. And in fact, when my last book came out and I had the good fortune to be on Live with Kelly and Ryan when Ryan was still on the show, talking about it. And one of the things was I said, hey, Ryan, you can just dunk your head into this bowl of ice cold water and you'll get like 75% of the benefits of being under the shower. And he did it, which was kind of pretty funny on live TV that he did that. But anyway, and I thought that was, gee, I hope I just gave really good information or not.
You did.
Not 100% of the benefits, but some benefit.
Well, I think you gave good advice. I saw that episode and congratulations for that. I think what you're doing when you put your face in cold water is you're doing a couple of things. First, you're holding your breath, which is an input into your brain that there's breath holding going on. And if you stay in long enough, carbon dioxide will rise in your blood. So there's more stimulation of information to your brain. But you're also stimulating the trigeminal nerve, which is the sensory nerves to the face. And those nerves activate the diving reflex, which is so when a seal or a whale or deep diving animals go underwater, that when their nose hits the water, that activates the signals in their trigeminal nerve, which sets up an ancient evolutionarily conserved reflex, which slows heart rate because it stimulates the vagus nerve. Now, when the baby falls through the ice and is underwater for 20 minutes and then is finally rescued from the frozen pond or lake, is revived and is totally normal and totally fine, that's because of their diving reflex.
Unbelievable.
It slows the heart. It slows metabolism. It slows down everything. Now, on the TV show, he didn't leave his face in the bowl long enough to have a full-fledged
No,
diving
he
reflex.
didn't. But I did say to the audience that I think I said 30 seconds, if I wasn't mistaken. Yeah, if I'm not mistaken.
Yeah, I mean, again, if your doctor says it's okay and you like self-experimentation, putting your face in a bowl of ice cold water, it doesn't even have to be ice cube cold, just cold tap water.
Okay.
And check your pulse. If your pulse slows, then you've stimulated your vagus nerve. By at least those fibers to the heart.
Oh, thank you. I'm so glad I brought this up, and now I feel better about having said that to many people.
I have not seen a good randomized controlled clinical trial of reducing inflammation by putting your face in cold water. And once again, it's a plea that everyone likes to talk about this. Let's set up the experiments and do them carefully with the right controls and the right. How do you randomize ice cold water? It's pretty hard to do that. You know when the water's cold and you put your face in it.
Exactly right. Exactly right. And also, your skin looks so nice afterwards. So that's like a little bonus. All right, let's get now to your book. I want to spend a little time talking about the book, The Great Nerve. Why did you feel now is the right time to bring out this book?
Because there are now new FDA-approved therapies targeting vagus nerve stimulation to treat conditions that for decades have been treated with powerful drugs. And this is very new. The newness of the story required that, combined with, as we keep talking about, the billions of web impressions on social media that are frankly overwhelming and confusing, even to someone who's studied the vagus nerve for 30 years. Those two things converged on what I thought was an important time to have a book that laid out the stories as scientists and doctors understand them today. This
and
is what
kind of set the record straight too on a couple of things. Absolutely. And you did.
This is what we know is true. This is what we know is false. This is what we don't know. This is what is probably misleading. This is what should be studied in a lot more detail.
Mm-hmm.
And the book isn't selling anything. The book is, there's even a chapter in there as FAQs, right? These are the questions that patients may want to ask their doctors, particularly now if the patient has rheumatoid arthritis. But the answers are for the patients too, and the answers are for the doctors too. I tried to write the book at a level that would not offend anyone's understanding and that would inspire others to help try to answer the questions that we still don't have all the answers to, and mostly to be a resource for patients and their families.
Yeah.
That's why I thought the time should be now.
Yeah, no, it's a perfect timing, of course, as you just said. And it's a wonderful book. I think I've said several times how much I've enjoyed reading it. And you're a great storyteller also, on top of being an amazing researcher and medical expert and everything else that you do. You are a great storyteller. So you call your book, The Great Nerve, you call the vagus nerve great. Why do you call it great?
The name wandering, which is what vagus comes from, like vagabond, the name wandering didn't seem right to me. And it's a nerve it's not wandering. It knows exactly where it's going and exactly what it's doing. And its path to all your organs from your brain and back has been honed over hundreds of millions of years of evolution. So wandering didn't seem like the right word. I didn't set out to rename it. It turns out that Galen himself, one of the original 2,000 years ago, arguably one of the original modern physician scientists, he used to call it the great nerve. And the reason he called it the great nerve was because he understood that it was carrying information from the brain to the organs, the voice box, the lungs, the stomach, and that this information was really, really important because when he cut that nerve in the neck of animals on both sides, they all died. So to my knowledge, and that's the only nerve, if you cut it on both sides in the neck, that's fatal. So I decided, well, Galen called it the great nerve. That's pretty good evidence that it is great. And I thought it'd be a good name for a book. So that's what I did.
And it is great. And it's a great book. And in fact, it's so great. Everyone listening in, we are doing a giveaway. 10 copies of The Great Nerve will be given out. You're going to have to go to my Instagram account, Barbara Hannah Grufferman, and you will see all the details about that. But we are giving this great book away. So really do join me over there at Instagram and you'll check it out. So Dr. Tracey, this was incredible. I had many more questions actually that I did not get to because I think you've spent a lot of time with me right now. So I'm hoping that you come back at some point because I think we're going to have a lot of follow-up questions from the audience after this conversation. So I really want to thank you. Now, is there anything that I may have missed that in your mind is really important that you want to make sure the audience remembers from this conversation today?
I would, first of all, thank you and happy to return. If there's questions that we didn't get to today, it's been a real pleasure talking to you as well, Barbara. I think the message to leave that can't be overstated, actually, for the patients out there that we didn't get to, and it's part of a much longer conversation, but don't let all the social media advice about just do this, that, and the other thing, and you'll be fine. Don't let that get you down because there is also a lot of evidence that damage can occur in the vagus nerve. And if that damage does occur, as we saw in long COVID patients, and we saw in the autopsies of some people that died from COVID, we saw that the virus had seriously damaged their vagus nerves. So it is possible that vagus nerve damage is actually contributing to conditions, and that if there was a simple fix for it, we said it before, then obviously people would do it. But now that there is a device available for rheumatoid arthritis, I'm hoping that it brings benefit to a lot of people. But we all have to be really, really careful when we say, just do this, that, other thing, and you'll live to be 100 and never have any more aches and pains. If life was that simple, we'd all do it.
If only it was that simple. Again, everyone, the great nerve, Dr. Kevin Tracey, my guest. I am so grateful. I look forward to seeing you again, and thank you very, very much. Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.